to What You Need to Know with Carla Pileggi Caviola. Today on our show, we will be talking about fertility treatment with our guest and specialist, Dr. Anna Flores Locke. Dr. Anna Flores Locke, it's so lovely to have you today.
Thank you, Carla. Thank you for having me.
I'm very excited and honored to have you on the show today. For all of our viewers, Dr. Anna Flock is a PhD. She has a PhD in counseling, and she's licensed as a professional counselor in New York and New Jersey. She is also an international award-winning author and educator. And that's not all, folks. She also is a full-time professor at Lehman College in the Bronx, New York, and an entrepreneur and owner of Charlanda Counseling Services, a mental health and fertility counseling center. So that is quite a
Whew.
long
Yes.
introduction there of your titles, Dr. Anna Flores Locke.
Yes. Thank you.
Amazing, amazing
Yeah.
work. I am so excited to learn from you today, and I know our viewers are too. Such an honor to have you. So again, yeah, we're just going to jump right in because I know we have a lot to learn from you today.
hmm
So tell me about your story, kind of like your personal story, educational background, kind of like how did you get into this type of work as a fertility specialist? And I know you're also specifically a Latina fertility specialist.
Yeah. Thank you for the question because my life story and my pain has really become my purpose, my professional purpose. And I'll explain that now. So, I have been a mental health counselor for about 18 years. And in my story, I got married about 14 years ago. We wanted to conceive right away, and we were trying for 3 years without success.
Yeah.
And so by second year, we finally sought out treatment from a medical doctor. And that's when I got immersed in fertility treatments because I had to go through in vitro fertilization to conceive my twins. So, because of that story, and then fast forward maybe 7 years, we had the twins. I was a twin mom. That consumed me. Along the way, I got my PhD as well. and I opened up,
Wow.
yeah, and I opened up my small business. So then, once I opened up the small business, Charlandra Counseling, which is named after my twins, Charles and Alejandra.
I love that. That's
Yeah, that's cute.
beautiful.
I love it too. And once I opened up the practice, I wanted to commit my time, my energy, my speaking engagements to opening the door for conversation on this topic of not only infertility, also about the Latina experiences of
Absolutely.
struggling to conceive. So that all happened because I had my own story and I went through my own depression and anxiety and I went through it alone. Even though I'm a counselor for 18 years, I didn't seek out specialized care. I didn't have a therapist. And then once I wrote my book, Body Betrayal, Understanding and Living with Infertility, that was my healing through sharing. That was we call it narrative therapy in counseling, cathartic moment, you can say. And that really shifted me into okay, I need to continue this conversation. I need to share to heal, and I need to be available for others who, like me, are struggling to conceive and need that specialized mental health support. So that's how we got to where I am today with infertility and mental health.
Wow, that's
hmm
amazing. So, absolutely. So, you had your own struggles, and you kind of, like you said, you kind of went through it alone, and then afterwards, through your storytelling, have now
hmm
been able to help other people, not just as a internationally known author,
hmm
but also in counseling as well. And
Yes.
so, is that something also? I know you mentioned your own experience. Tell me about kind of like the work experience,
hmm
you know, working were you getting education also in regards to fertility treatment? And I know you mentioned your experience as a Latina. Tell me a little bit about those two.
Yeah, those are great questions, because when I first went to fertility clinics and talked to doctors, I said, "Oh, I've gone through this journey myself. I'm a mental health counselor, and I want to help your patients through the social through the emotional turmoil of the journey." And the response I got, which was hurtful, of course, and valid, was, "What's your credentials? What's the training that you
Yeah.
have in infertility?" So then they guided me to the American Society for Reproductive Medicine, which is a not only professional home for those in the field of reproductive medicine, it's also a resource for patients. So that's one resource I provide to my clients and to your listeners, is asrm.com. And so they're a national organization, and they provide training. So they have a mental health professional group. I joined the group. I got the training. I think probably more than 20 hours of training, not only on the medical terminology and aspects of infertility, also about the complexities of mental health and infertility and how those
Yes,
intersect. And therefore, after I got the training, I joined that professional group. I started attending conferences, and that's when I started to get that specialized training
absolutely.
to make me more competent
Mhm.
for infertility mental health.
Yeah. Like you mentioned, there's a lot of terminologies. There's the whole
Mm-hmm.
medical side and then the whole emotional side of counseling people through that, which often can be really like an emotional roller coaster, right?
Yes, definitely. Yeah, that's a big term we use all the time.
Mhm.
It's an
Yeah.
emotional roller coaster.
Yeah.
And, my work being Latina, especially, I also emphasize and magnify and amplify
Mhm.
in just my writing, my social media post, and is the Latina experience and the male experience, because they're both very silenced. And so going into the Latina experience, we think about culture and we
Yes.
think about stigma, not only stigma with mental health, but now stigma with fertility or reproduction, sexuality. Those are
Mhm.
just words we don't talk about in the family, right? Other than the expectation is,
Yes.
and I faced it once I got married. When am I going to have grandchildren? When are the kids coming?
That's right.
And for felt like very 3 long years, every time I spoke with family, it was, "Where's the babies? It's not that hard. It only takes 5 minutes. Oh, maybe next Father's Day we could celebrate you," to my husband. And so these constant, and I call them reproductive microaggressions,
Yes.
because they're very hurtful. Now they're coming out of love, right? Our family,
Of
they're doing it
course.
out of love. They don't understand. And that's one of my biggest missions, is to help not only couples and people going through infertility, but also their family, also their community. Because those reproductive microaggressions, those comments, those statements, that pressure,
Absolutely.
especially as a Latina woman, the pressure of, your job is to have kids, to provide grandchildren, takes a toll on us emotionally.
Yeah.
And so it's not only for us to take care of it through a mental health perspective, it's also helping our communities and our families understand how that is hurtful, how that
Yeah.
isn't producing the child that you want. It's only making it harder, right?
Yeah.
No amount of shame or guilt or, persistence is going to create the baby when a couple is struggling.
Yeah.
Because, because infertility is a medical condition,
That's right.
right? It's a medical reproductive issue. So it's not by choice
That's right.
to not conceive, to not bring the baby home. So that is really like a big emphasis for me with the Latina community, is that family obligation, the value of family, and the pressure a lot of us face because of that highly emphasized value of children
Yes.
in our
Yeah.
culture.
That's a great point. Yeah. And like you mentioned, people might mean well, but they don't realize like
Mm-hmm.
people in that are dealing with infertility are already dealing with stress and
Mm-hmm.
anxiety and overwhelm and potential,
Mm-hmm.
losses,
Yes. Mm-hmm.
depression. So
Mm-hmm.
again, adding on that pressure, even though they mean well, it's just further adding on to what the couple is already dealing with,
Right.
which is a lot.
Mm-hmm.
What other common challenges do
Mm-hmm.
you see women facing, you know, while you work with them in regards to fertility treatment,
Yeah.
women, and like you mentioned, the partners and the
Mm-hmm.
couple, obviously everyone is affected by the fertility treatment process.
Yes. Right. Well, another aspect too, when I think of culture in Latina, the Latina culture is religion. Right?
Mhm.
We are very steeped in religious beliefs, and for most of us, it's the Roman Catholic belief system. And so I bring that up because, and spirituality, I like to be inclusive, right? But religion and spirituality, because a lot of times before couples or individuals seek out professional help, they're going to their churches, they're
Yes.
going for prayer, they're talking to their priest, to their pastor, to their spiritual network to
Mhm.
seek out some kind of intervention.
Yeah.
And we know, because infertility is a medical condition, it warrants medical attention and treatment. So
Yes.
I'm a very both and person where, yes, I use my prayer and my faith and my religious community to
Mhm.
support me as I went through the journey. And I very much followed what the doctors had said and, did what I had to do from the medical perspective. So for me, it's
Absolutely.
both and I feel, and I know oftentimes that can be an initial barrier for some people because they wonder, like, if I pray hard enough, I'll get pregnant. Or maybe their religious denomination doesn't believe in reproductive medicine. And we
Yes.
could have a whole nother podcast on reproductive medicine and religious doctrine and beliefs.
Sure.
And right, there's a whole, and we just had, right out of Alabama, I think they just had a legal, they said embryos are considered a child.
Yes.
And so
Yes.
that
It's
again
fairly
is
weak. Yes.
right. So that's hot news right now. However, that could take a whole nother podcast just talking about that.
Absolutely. Absolutely.
So I just bring that up when we talk about barriers, is moving into, okay, I go to my faith community, that is part of my wellness plan, and I also need professional support,
Mhm.
and that's mental health and reproductive medicine. So that's one aspect. The
Mhm.
other aspect, when we think of the couple, is, in my experience, was it took us 3 years before we went to a doctor because my husband and I were on different pages when we thought about what to do to conceive. Right? My
Yes.
husband was more on, oh, well, it'll happen. Let's just be patient, which is typical as well. Men go more into problem solving, like, it's
Mhm.
okay, it'll take time. And the women are more so like, it's been 2 years, it's not going to happen. We need to take action and do something different.
Yeah.
And whenever you're facing something different, that's scary for anybody, right?
Yes. Yes.
Because we don't know what that world means. The
Yeah. Change
testing,
is scary, and yeah,
the
testing, all of it.
testing, the probing. If you have to do treatment, there's self injections, there's medications. I mean, it's a lot. And so for a couple to ask them to take their bedroom, right, their private, intimate life, let's say,
Yes.
into a doctor's office, it's embarrassing, it's scary, it's odd, right? It's different. And so that too can be a barrier because a lot of people just wonder I what's this gonna mean? What's this gonna entail? I'm
Yeah.
okay with I can do in the bedroom what needs to be done to conceive. Now you're telling me to do stuff outside of the bedroom to
Yeah.
create our baby.
Very
And that's it's
uncomfortable.
uncomfortable.
Yeah. Yeah. So that's another barrier
Yeah.
besides maybe like spiritual beliefs, just feeling uncomfortable about it. Like you
Hmm.
said, normally it's more of a private, intimate thing, and now we're
Right.
exposed.
Yeah.
Um, do you see other, um, barriers as to why people aren't maybe seeking out
Hmm.
fertility treatment?
Yeah. Another big one is finances.
Hmm.
It's still in the legal system as far as getting coverage through insurance companies to making
Yeah,
that. And some states. So let's just say financially, it's costly.
absolutely.
So
Yeah.
it is a privilege. It is a financial privilege for people to pursue fertility treatment.
They don't have, depending where they live, they might not have accessibility to a
Mm,
specialist, and then that
yes.
requires travel, right?
Yes.
And
Oh, I've
for
heard many.
fertility treatment, we have to be so on point as to like this is the day and the time that this needs to
Yes.
happen, for instance, for IVF and things like that, right? So
Yes. Yes.
imagine living far away. I think
Hmm.
sometimes distance can be a hindrance as well.
It is. I've heard stories of people traveling hours and
Yeah.
or spending the night in a town where the clinic is to get whatever done at that time. Yes. So finances, distance, time, even, right? Finding because if you're working full time, you have to schedule this in to your
Hmm.
life for many months. And I remember the other part that I wanted to share was the health disparities.
That's
So research tells us that, well, a couple things, right? The Latina ethnic group is the youngest and fastest growing group in the US.
right. Hmm.
And I share the youngest because that puts us in this position where Latina women are going to be producing children for our population growth.
Yes.
However, they are a lot more, a lot less likely to go seek treatment when there's a fertility issue than white counterparts.
Mm.
So we have the health disparities. We have the statistics telling us that even though Latina women face infertility at the same rate as white women, we're not going to treatment.
Hmm.
And so when I think about that from a social justice perspective, and I've spoken to people as well, and even me, like I'm a Latina mental health counselor, and I talk to other Latinas, and
Yeah.
I'm here to help, right?
Yes.
And my door is open, and yet there's still stigma, and there's still that cultural mistrust,
Mm.
that
Yeah.
mistrust of we, our bodies have been used for experimenting on birth control, for example. Our
Mm.
bodies have been we've been sterilized
Mm.
historically. So when you talk to Latina women about, oh, go see a doctor about your fertility, it's right away, what are they going to do with my eggs? What are
Yeah.
they doing with these hormones? Like it's very a suspicious
Yeah. Lack of trust, right?
response. Yeah.
Yeah. Yeah.
So that right there stops us from going.
Hmm.
Plus, most of the doctors are white individuals. I don't know if it's more men than women, but mostly white. So we also don't have women of color who are doctors who look like us and understand this mistrust,
Hmm.
understand this history for us to feel comfortable to even
Yeah.
go to the doctor.
Yes. Yes. Do you find that also in regards to other ethnic backgrounds as well, Dr. Ana Flores Locke?
Well, the doctor I ended up with after I tried three different doctors, and that's another part of this journey, is the first question I ask my clients is, do you like your doctor?
Yeah,
I believe, and you have to have a strong relationship because you're talking about intimate stuff. And this
absolutely.
doctor's going to call you and tell you whether you're pregnant or not. So you
Yeah.
want to like your doctor, right? So that's why it took me 3 tries. So that's a side story to the point that the doctor serviced a lot of Orthodox Jewish women. And I noticed that in the waiting room. And so I share that because I think there is this comfort in knowing, okay, I'm going to seek out a Jewish doctor when I'm Orthodox Jew, and that's going to be comfortable for me. And the same, I think, in our communities
Mm-hmm.
as well. So, yes, I think another example I've also seen is in the Muslim community.
Mm-hmm.
Um, I've had experiences of that too, because there's also the misunderstanding
Mm-hmm.
culturally with um, conceiving a male child. So that has come up with fertility. Somebody maybe in the Muslim tradition needs to conceive a boy, and that whole thing can complicate the fertility journey as well for some women.
Yeah. So culture
Mm-hmm.
really does play a role
Yeah.
in, fertility and how couples view, even not even necessarily, well, even contemplating, is this something we're going to
Mm-hmm.
do or not, right? In
Mm-hmm.
regards to our situation. What are the benefits of seeking a specialist like yourself, Dr. Ana Flores Locke?
Yeah. So the benefits are we have the additional training. We
Hmm.
have peers that we can consult with because believe me, I am learning every day, all the time, so many different unique caveats to this field. And it's
Yes.
great that I can send out an email to my group and say, I need a resource for this, or I ask a question. So I get that peer consultation from other experts in the field. And that then translates into clinical care, competent clinical care for the client. So we have
Hmm.
specialized training, access to that consultation, and also it helps us as the provider to help the client even navigate the whole system.
Yes.
Because, like you mentioned earlier, there's terminology,
Hmm.
there's pharmaceuticals, there's, you know, the timing, and that's just the logistics.
That's right.
Now you put on the layer of, oh, we need timed intercourse. Now my husband resents me for sex because I only need him when it's time.
Right.
And now you've got a pain point in their couple intimate relationship,
That's right.
right? And that's the piece too that we understand as trained specialists in fertility. And we talk about it, right? Like that's part of
It
our
sounds
assessment.
almost like a robotic thing, like, oh, we got
Yeah.
to do this right now instead of a
Hmm.
natural. Yeah.
Yes.
Yeah.
Right. And then we can broach that topic. What's your intimacy like? Because oftentimes men feel used, and then they, withdraw, and so we know like those couple dynamics that happen, so that we can address it with couples when they may
Right.
not bring
Yeah.
it into the room.
Yeah.
Mm-hmm.
And maybe I'm not sure how our viewers view fertility treatment, but it is one of the top two stressors on a
Mm-hmm.
relationship,
Mm-hmm.
right?
Mm-hmm.
And
It is.
certainly, I mean, I work as a psychotherapist as well, perinatal mental health
Mm-hmm.
specialist, so working with pregnant postpartum moms and so forth. Um, we don't have to wait until we're in crisis to get counseling, right? It's
Mm-hmm.
really important to, if you're already noticing things, if you're already struggling, just to have that safe space to talk to a
Mm-hmm.
provider, to be able to figure out what's working and what's not working, and then tweak
Mm-hmm.
things can go
Mm-hmm.
such a long way, right?
Definitely, because I believe in relationships, and I believe that in the midst of the biggest stressor in your relationship, you need one another more than ever.
Absolutely.
Like, infertility can be the thing that bonds you even closer.
Hmm.
And oftentimes, like you've shared, Carla, it breaks couples apart.
Yes.
Right. And I've heard stories of men saying, well, I'll divorce my wife so she could find someone who's fertile and get her pregnant so she could have a baby. That's extreme,
Yeah.
right? I mean, that I know. I was shocked too. And then the wife, luckily, was like, I didn't marry you for that. I love you, and they figured it out in that story. But there's
Yeah.
so many stories like that where it's just so unknown territory that to have that professional help, to just have a safe, courageous space to talk about it,
Mhm.
can really save those
Yeah.
relationships
Yeah.
when you
And I
really need
love
each other. Yeah.
Absolutely. And I love what
Mm-hmm.
you said about really trying to work on as a team versus
Mm-hmm.
it's me against you and,
Mm-hmm.
something's not working or pointing fingers or whatever people,
Mm-hmm.
sometimes couples end up getting into like different
Yep.
kind of cycles and,
Mm-hmm.
so just figuring out, well, how can we actually work together?
Mm-hmm.
And like you said, even grow in our
Mm-hmm.
relationship. This doesn't have to
Right.
necessarily tear us apart.
Right.
So that's really
Mm-hmm.
encouraging. Hopefully, this is going to be
Yeah.
very encouraging for our viewers as
Thank
well.
you.
It doesn't have to be, quote unquote, death sentence, right, in your
Mm-hmm.
relationship, and it can actually even enhance your relationship.
Yes.
Um, so that's
Yeah.
really helpful information, Dr.
Yeah.
Flores Locke. What are the most important tips you want to give to anyone watching today? Anyone that might be struggling, or maybe they have a
Mm-hmm.
friend or family member, coworker
Mm-hmm.
that might, be struggling with fertility, or maybe they haven't
Mm-hmm.
even disclosed it, but there's kind of almost like, because there, like you said, there's guilt, there's shame, there's other
Yeah.
things that maybe sometimes people allow to creep in.
Mm-hmm.
But what would be your top tips for those viewers today?
Yeah. My top tips would be to share. Sharing is healing, and those around you want to support you. And I do tell people this, and I believe this firmly, like, you're not failing because of lack of trying, you're
Mhm.
failing because of lack of support.
Mhm.
And so, really, even if it's one person you trust, and to share. And for those of you listening that are part of that family or community, is to simply have a hug ready for somebody.
Yeah.
Obviously, ask consent, right? But I say it as a hug because we don't need to say something.
Mhm.
Simply saying, I'm here for you.
Yeah.
My arms are open. You want to come over and cry over wine and I'll listen? That's what I'll do. And so, really restrain ourselves from those comments, reproductive microaggressions. Just relax.
Yeah.
It'll be okay. You're doing, we don't even have to say anything.
Yeah.
And
Just
the
feeling with
power,
them, right? Just
yes, the power of the silence and being together.
yeah.
I think that is the biggest tip, through
Yeah.
sharing and connecting, and not having to say the right thing and problem
Yeah.
solve, because that's not what our emotions need right now.
Yeah.
We just
That's
want
right.
that hug, listening ear, sofa, whatever it is that will let that person feel comforted.
Absolutely.
Mm-hmm.
Yeah. Sometimes people don't even want to talk in the moment, and then they might
Right.
later. People might want to give advice, but then put their foot in their mouth. So,
Yeah, and they're well meaning. Yeah. So it's just like, just
absolutely.
don't say anything.
Just be with the
Yes.
person and just love and care for them.
Yes.
And
Yeah.
yeah,
And that's
and
so
maybe let
powerful.
them lead, right? Let
Mm-hmm.
them lead. Yeah.
Mm-hmm.
So, this has been so helpful. And again, I know the viewers are going to be, this is going to be very
Mm-hmm.
transformative to many viewers. How would anybody reach somebody like yourself, whether it be a
Yeah.
fertility specialist in their area? And then,
Mm-hmm.
of course, how would somebody reach out to you, Dr. Anna Flores Locke, in your area?
Sure. So, resolve.org, resolve.org. They're the National Infertility Organization. So they not only do advocacy and leadership, they also are a directory. So clients can go, they can look up support group near me, therapist near me, and I'm listed in that directory as a support group provider and mental health counselor. So they're all vetted through resolve.org. So you know that they're specialized
They're trained.
and they're trained.
Yeah.
And ASRM.com also has a directory too. So those are the first two places I refer people to. And and then for me, I'm in New Jersey, New
Mhm.
York, Illinois as well, and I'm licensed in Puerto Rico. So I could do telehealth in any of
Wow.
those states. Yeah.
Amazing.
And so through my website, you can contact me, email me, and I can definitely support you on your journey. You
Yeah,
and your
that's
couple, or your partner, if that's what you
absolutely.
guys need.
Yeah,
Hmm.
absolutely.
And I'm also doing once a month live workshops on Zoom, and I'm only doing like 30 minutes. And this month in February is on navigating the detour, because my husband and I have called our journey a detour to getting to parenthood, and how you and your partner can stay in the same car because you're going to the same destination. You're just
Yeah,
going on a detour and not kill each other in the process. Right? Find
I
a way
love
to,
that. Yeah, that's a good
yeah.
analogy. We want to
Yes,
avoid that one, right?
exactly. So that's upcoming. So,
Oh,
and on Facebook, I give tips every week. And on LinkedIn, also, I'm very active there with giving, just affirming stories to let you know you're not alone and your story is not unique, and that we are in this together as women
yeah.
struggling to conceive and build a
Wow.
family.
Yes. Well, you're such
Hmm.
an inspiration. Your story has been very inspiring today and touching. And not only have you overcome the challenges and come out stronger with you and your husband, like you
Mm-hmm.
mentioned, but also now you're helping others through their same struggle. And I know not only are you have your practice, you're teaching, in a university, you're also a speaker. So,
Mm-hmm.
you have so many ways to add value to others. And yeah, you're just doing a great, amazing work.
Thank you, Carla.
Um,
As are you. We all, as are you, Carla. I know you help a
oh,
lot of mothers too.
thank you. Thank
You're
you so much. It's
welcome.
always an honor to come alongside people,
Yeah,
right? But yes, I've
definitely.
it's been absolutely fantastic having you on the show today, Dr. Anna
Hmm.
Flores Locke. And like you said, maybe we'll do another one at
Yes,
some
there's
point
so
down the
many
line.
topics. Yeah, I would love to.
Yeah, there's a lot to talk
Yeah.
about. There's a lot of ways we can educate, empower, and help
Hmm.
people move towards health and well being. I really appreciate you sharing your expertise and
Hmm.
clarity today, again, regarding the amazing work you're doing and specialized field of infertility, helping women and couples, in addition to, really understanding the Latino,
Hmm.
community and culture. Um, so again, viewers, you know how to reach Dr. Anna Flores Locke if you would
Yeah.
like to be in touch with her. She's amazing. If you found this time educational, empowering, insightful to help you move towards your health and well-being, please click on the button below and subscribe to my channel. Also, please feel free to share this with your family, friends, coworkers, or anyone that you think might benefit from today's episode
Hmm.
regarding fertility treatment. And thank you so much for tuning in. It's been a great time, and I look forward to sharing what you need to know next time. Take care and be well.